Hi, it's Kate, a licensed acupuncturist at Holistic Therapy Ealing. I'd like to show you some of my tools I use in the clinic on an everyday basis. Let's start with needles that aren't scary because they're really tiny. Most of the needles I'm using are Japanese style, so they are the thinnest needles possible. Some of them are thinner than the strand of the hair. So I'll show you some that I use in the clinic. So they come in the guide tube, most of them. And you can see a little tiny needle. So once I choose the point, open it fresh blister, I put the guide tube on, gently tap on the point, insert it to where it needs to be, and it's there. I might leave it in for a few minutes. I might take it out. It depends what we try to achieve. So that goes into sharps box. Another tool that I'm using in the clinic is guasha. And guasha was historically used as a home remedy. So it's also called coining or spooning, because what you need to do guasha really is a little bit of oil and a smooth edge object. For this we use lids for hygienic reasons, because otherwise we can't sanitize the tools properly. So guasha is nothing else but applying a bit of pressure with the smooth edge tool. You try to spread the muscle fibers. It's very good on the back, very relaxing. It can create a little bit of redness on my skin. Not much is happening, there isn't much stagnation there. Another thing that I use is capping. That's the cap, the silicone cap that I will use on children, so I will normally give it to the parent to do it at home. Capping is very simple. Activating the blood, moving the blood in the channel. You can kind of see a little dome of skin. So we're lifting the tissues. It can leave a little bit of marking like this. If you can't have needles for some reason, or you really don't want them, I'll use a laser pen. Using the same principles, we choose the points gently and use the laser instead of needles. On children, I'll use some Shiny tools. This is, again, similar to guasha, gentle movement in the channel or gentle tapping. That's the tool that kids like playing with. It's on the spring. You just apply a bit of pressure. Something that I love using is e-seats on either ear points or body points that you can take it with you. Often use Pionex needles. They are, again, tiny needles. This one is 0.9 millimeters long, so probably not visible, that we apply onto the point, and you take it home and you keep it on for a few days. I'll give you a separate container for it to bring it back. One more tool, evil bone water, for any inflammation or pain, any signs of cold, to warm up the area, to relax the muscles. So these are just a few of the tools that I'm using in my clinic. If you have any questions, do get in touch.